Good morning, good morning, morning, good morning, morning.
Welcome back to the morning show on Tobago Updates Television. It's now 7:17 a.m. So you still have some time to get to work. If you're getting there for 8, remember to drive safely on our nation's roads. All right, we begin conversations this morning with our very first guest in studio. She is Dr. Alina Wiliams, and she is a senior clinical psychologist. And this morning we want to focus a little bit on our mental health. We want to ensure that our mental health is in the right place. So we're going to do a little check-in this morning. Good morning and welcome.
Good morning, and thank you for having me,
Thank
Adanna,
you.
and good morning to Tobago.
Right, thank you so much for joining us this morning. You know, as I mentioned, our mental health is something that is so very important, you
Definitely.
know, and sometimes we take it for granted, you know, we abuse ourselves, you know, we take on more than our capacity sometimes, and we just forget to check in, we just forget to, you know, to take a moment and relax and to make sure we're in a good place.
Correct.
And I want you to just, you know, just talk to our viewers a little bit. Why is it so important to ensure that our mental health is in a good place?
Okay, so let me start by saying that there is no health without mental health. So when people think about health, they think about physical health. And there's so many metrics to measure physical health that it's easy to understand it, but it's difficult to understand mental health. So for example, like blood pressure, cholesterol, we have a range of what's healthy. But when it comes to mental health, people don't consider those ranges. So our mental health is important because basically it encompasses the way that we think, the way we feel, the way we behave. And that determines our physical health, our relationships with people, whether we can work productively in our environment, whether we can contribute meaningfully to the society, to communities, and whether we can realize our full potential. If we don't have good mental health, we find that it's difficult to maintain relationships, it's difficult to maintain our employment status, it's difficult to be who we need to be fulfilled in life. So mental health is definitely integral when we talk about health on a whole.
And how, you know, as I mentioned earlier, that sometimes we take things for granted. You know, we're overwhelmed. We have children who are at school. They might have challenges in school. We have financial issues. We have so many financial obligations. We have obligations to our partners. We have obligations to maintain good, healthy friendships.
Correct.
Some of the things you mentioned as well. And so the demands on us are so great, and we feel as if we have to be perfect at them all. And so we take on all of this and we go on in our daily lives, just doing whatever. And sometimes we get to a point where sometimes you end up being depressed, you end up being stressed. What are some of the things that you can identify as that are affecting, even the slightest things that are affecting your mental health?
So when we look at the contributing factors to deteriorating mental health, we're talking about like risk factors and predisposing factors. So from the get-go, we would look at biological factors like a genetic predisposition, but also we have to consider the environment. And as you mentioned, are we exposed to trauma and stresses more? Yes. For example, if you look at the news, right? Every day you look at the news, there's more violence, more crime, there's escalating issues in school. So we are exposed to stress via social media, via the news outlets. We are exposed to stress at work. We have multiple roles. Most people, especially in Tobago, have many jobs. So we have a full-time job, and then people have their businesses. So we're doing so much more, which obviously has an impact on our mental health, that wear and tear. And if we don't take steps to improve our mental health, it could deteriorate.
Welcome back to the morning show and Tobago Updates. Again, I apologize for that technical issue. We continue conversations, of course, with mental health. You know, as we said, it's a very important topic. We're discussing some of the stresses and the traumas, you know, things that contribute to your deteriorating mental health with Dr. Alina Wiliams.
Yeah. So, as I was mentioning, the environment plays an integral role on our mental health, and it's something that we have to constantly be aware of, that we have to monitor and keep an eye out for. So that includes our environment, includes our workplace, our home. We spend a lot of time at home. So, you know, children, spouse, partners, relatives. It includes the different organizations you may belong to, churches and different communities. There are also internal stressors. So illness, for example, plays a big role in determining our mental health, because physical health and mental health are intertwined. So our mind and body are linked. You can't have one without the other.
And I know also social media plays an important part in our mental state.
And especially for teens, we've noticed an increase in anxiety and depression in teenagers, especially young girls, because of social media. There's this desire to live the life that you see on social media. And a lot of young people don't realize that people put forward their best life on social media. Nobody posts their failures or their down moments. And when you compare somebody's best to what's happening in the background in your life, you could tend to go through this phase where you think you're not meeting standards, you know, you're not living up to where you should be, you're not living your best life. So we found not just depression and anxiety, but body image issues among young women and young men.
And I just want to advise you, most times those things are not 100% accurate. So that's just a point to note. How can we check in to see where our mental health is? What are some of the things we can do?
Okay, so when we consider mental health, we all have mental health. There is this belief that if you don't have a mental illness, it means that you have good mental health. But the absence of mental illness is not an indication that you have good mental health. So our mental health, just like our physical health, falls along a continuum. And I just want to bring that up on the screen. If
Do we have that diagram to bring up on the screen so we could talk about it?
So this particular diagram is something I use with all my clients that I see, with people that are close to me, and it's a good way to check in. It basically says that our mental health falls along a continuum where we are either in the healthy zone, the reacting zone, the zone where we are tending towards struggling, or the illness zone. And essentially, there are different events, external or internal, that determines whether we move forward or back through those zones. So when things are good, we would be in the green zone. This is the healthy zone. And if something happens and we have a reaction to it, we could move into the yellow zone. This is the reacting zone. And once we're in this zone, we experience distress, right? Now, how we respond in this yellow zone determines whether we would move on to the injured zone, where we have significant impairment in our functioning, which means impairment in the way we think, the way we behave, the way we feel, or whether something happens and we could move back into the healthy zone, which is the green zone. And if you look closely, you will see that each zone is marked by different symptoms or experiences. So you would know what is normal for you in terms of your experiences. But if there's a shift, if there's a change in any way, it means that you're having a reaction and you have to examine where you fall on the zone. So some things that you want to look for is, one, are there changes in your mood? Are you feeling more irritable, unhappy? Are you feeling sad, depressed, more frustrated, or even elevated mood? Are you finding that your mood is so expansive and elevated, you're on cloud 9? Right? You want to look at your physical health. Are you eating and sleeping well? Because when your mental health is compromised, it affects those two things in particular. Can't sleep, can't eat, or you sleep too much, you eat too much, right? And you also want to look at how you're responding to the different stressors in your life. Do you find that when you go to work, you're making mistakes, you're not able to concentrate, you're not able to focus? Or are you finding that there's such an impairment in your functioning that you can't even get out of bed? Like it's too much to just do basic tasks like brush your teeth or go to bed. So you want to look at changes in how you function, and you want to look at how long these changes last, so duration. You want to look at intensity and severity. So if something happens and you feel sad for 1 day, 2 days, we won't say that you have a mental illness. Your mental health may be compromised at that point, but if you do certain things, you could get back into the green zone. However, if you find that over a prolonged period of time, these changes keep persisting, then that's something you have to consider. So the key basically is self-awareness. You have to know what is normal for you, and then you have to always check in with yourself. How is my mood? How is my sleep? How is my appetite? How am I relating to people? Am I withdrawn? Am I less active socially? You have to constantly check in on several domains in your life that way.
And I know while you were speaking, I was looking at the diagram. If you could pull it up again, they had you had 4 zones.
Yes.
But you had them in 2 specific categories.
Yes. I'm glad you mentioned that. So this is very important for the viewers. The green zone and the yellow zone, you would see that it falls under the category of self-care and social support. In these 2 zones, what you do is important for maintaining your mental health and also the people you surround yourself with. So when it comes to mental health, we consider social support to be a very high protective factor. If you're going through something and you have people by your side, around you, surrounding you, it's likely that you would not progress to the orange or red zone. However, if you find that due to whether it's external or internal events, you do progress to the injured or ill zone, which is the orange or green, those 2 zones require orange or red, yes. Those 2 zones require professional care. At this point, it may be that your functioning is so impaired that it's not enough that you just have social support. You may require actual treatment, actual management, whether it's via medication or therapy or some other intervention. And these zones are very critical because the longer you stay in those zones, the harder it is to move back into the phase of healthy. And so you want to manage your mental health symptoms. Once you move from green, you find that you need to act quickly in order to either stay in that zone or to move towards that zone.
You know, Dr. Williams, I really wish we had more time to talk about this because, I mean, we've had conversations about mental health before. We know that mental health is a very important topic, but this conversation is so engaging that I want to know so much more. It's unfortunate that we have to wrap things up, but, you know, if we do get the chance to have the opportunity to speak again, I would welcome it. And, you know, I just want to encourage our viewers this morning to check in. Check in with yourself, as doctor said. You know, you be self-aware. You know what is normal for you. You know what your regular day is like, what your feelings are usually. And from the moment you realize that, hey, I feel a little bit off, you know, talk to somebody, you know, even if it's a mom, a dad, a friend, whomever, just have that conversation to see if they too have noticed any changes in your behavior. And don't be afraid to ask for help.
Yes.
We want to be Superman and Superwoman, and we want to feel as if we can do all things and do all things perfectly. The Bible says that no one is perfect. No man on the face of this earth is perfect. So don't think that you are or that you have to be perfect. Whenever you feel a struggle or a strain, reach out to somebody for help, and let's just ensure that we have good, healthy mental health. Let's not compromise our mental health too much. As the doctor said, without mental health, you can't have any other kind of health. So let's take care of ourselves and ensure we have the right type of support we need to go on and carry out our daily functions. Thank you so much. We've been speaking with Dr. Alina Wiliams, a senior clinical psychologist, and we do hope that the information we shared today is going to help you. Ladies and gentlemen, we're going to go for a short break before we continue conversations this morning in studio with our guest. And before we go, we invite you to share the live. Share the live, share the live. We'll be right back.